Indeed, thank you very much for joining us. Exactly 1 year since the coronavirus pandemic struck the country, it is nothing but a blessing to be here today. And joining me right now is the Cabinet Secretary for Health, Mutahi Kagwe, and we shall be looking at the hits, the misses, and the experience, the whole experience of the coronavirus pandemic here in the country. Waziri, thank you very much for making time for us.
Thank you very much for this opportunity.
Indeed, it has been a journey. It has been a long journey.
A journey and a half. Yes.
All right, now getting into it, Waziri, I'd like us to start with your personal experience. You took up the Cabinet Secretary position at the Ministry of Health at about the same time the pandemic struck the country. How was it for you to have your first assignment announcing a pandemic to a whole nation? And how has it been down the line?
Well, it's been a challenging time. At the very least, it's been challenging. As you will recall, on the 28th of February last year, I got 2 letters from the President. One of them is my appointment as a Health Cabinet Secretary, and the other one was my appointment as the Chair of the National Emergency Response Committee. Exactly 12 days later, we had our first case. Nobody knew what the disease was. Nobody understood it. Nobody had any idea where it was going to take us. So it was a very challenging and difficult period. Not that it has ended. We are still in the midst of it. But I can tell you that with the leadership that President Kenyatta has given us in the country, we have been able, to improve our health system substantially. There were times when it was quite challenging, but at no time did we get to the point where an individual would not be able to get a hospital bed. So we adapted and adopted as we moved along. And today we have got a sizable number of people in the healthcare system who are now pretty good at dealing with the situation, because training was also part of what we had to do. Of course, we cannot gainsay the presence now of the vaccine, because hopefully this is what is going to help us in terms of developing immunity, sufficient immunity in the country for us to go back to normal.
You've mentioned a substantial improvement of the health sector. We'd like us to look at the achievements, and that entails infrastructure. It entails, I would like you to touch on the procurement system in as far as vaccines are concerned, in as far as medicine is concerned going forward.
Okay, now let me put it this way. When we started off in March of last year, for example, when it comes to issues of isolation, where were we going to isolate people? Which bed what capacity did we have? We had 0. And I remember going around the country and trying to get people and buying beds from everywhere. Today, we have over 7,000 beds across the country. Our infectious disease room in Kenyatta National Hospital had 8 beds, as in 8 beds. Today, we have got over 500 beds across the country. So clearly, there is a lot of improvement and growth in the health sector. But there are also other aspects of this growth that are probably not too obvious to the eye. And that's the behavior, the change in behavior, especially on issues of public health, issues of primary health care. Because if you look at the disease burden, from March last year to now, there are very many other types of infections and diseases that we have kind of suppressed. And this is all as a result of improved hygiene measures by everybody.
Waziri, on that matter of the vaccine, when it comes to the time Kenya will be now buying or purchasing the vaccine, how transparent or how strong is our procurement system before it now gets to the disbursement of the vaccines to the people?
Our idea is that we will use exactly the same system. CDC Africa has got a platform from which African countries can buy in a singular system, so that you go to AfriExim, they allocate the money that you are going to use, they allocate you the vaccines that have been allocated to you. For example, Kenya has about, right now, we have about 10.2 million doses that have been allocated to us, and it is Afri-Exim that pays for those doses, and then the doses come here to us, and we run them the same way we are running the current one. So we will pay Afri-Exim.
All right. Waziri, we have had, doubts by Kenyans, especially having countries neglect the AstraZeneca Oxford vaccine in particular. How would you be able to gain confidence in Kenyans to assure them that this particular vaccine is safe? Recently, you mentioned that the vaccine was well tested with the new variant. But again, you've mentioned that variants will keep on evolving and coming about. In the event that the AstraZeneca vaccine is not compatible with a variant which may keep evolving, what is your plan after that?
That will be a global challenge that will be handled globally, as I say, by scientists and leaders in our science at a global level. Because if it is doing that in Kenya, it will be doing that elsewhere. So far, we have no evidence ourselves to show any negative effects since we have started that, but it's only been a week. So since we started, we have not seen any negative effects as far as our population is concerned. Yes, we have had some countries today, for example, they were talking about an issue, I think in Denmark or something, but which they said is not, they have not established that is necessarily as a result of AstraZeneca. But what we do know today, up to today, is that the vaccines that are available and are used for all variants. There is no variant so far that we have been told which does not respond to the use of the vaccine. As you know, these are trials going on all over the world. So it's a question of so far so good, but if indeed we do get to a challenge, if we are faced with a challenge, of course we'll tackle it at that time.
Waziri, lastly, as we conclude, very briefly, will you touch on the lessons learned from COVID-19 pandemic, and also on the same note, on the third wave? It is now 1 year down the line, and now we're witnessing the third wave. Are we back to square one?
It is not unusual that we are here. In fact, if you remember, sometime in January, we did predict that we could see the possibility of an upsurge come March, which is now. All right. So this is something we had kind of foreseen, and we are prepared for it. Obviously, very new things can come at us, which we do not expect right now, and which we cannot foresee. Suffice it to say that our job is to prepare ourselves, is to prepare our communication to the people, to let them know. Our job is to talk to Kenyans transparently, without hiding anything from them, so that they can also protect themselves. Because by the end of the day, the reason why you hear things going bad towards the end is because by that time people are suffering fatigue. Is what we might call the virus fatigue. Because they have been out there, they haven't been able to do what they normally do. They haven't been able to visit people that they would normally visit. So clearly, it's a strain. It's a strain on people, and people do get tired of adhering to these measures that they were not used to prior to this event. But my message and my plea to Kenyans is that please let us not get tired now. Because if going by previous pandemics, we don't know whether this is going to be the worst wave that we can handle. My plea to Kenyans is that this is the time to be even more careful than we have been in the past. Even if we are tired, even if we are strained, let us not give up. Let us not lower our guard as far as the simple measures that we have given, the mask, the sanitizing and washing of the hands, the social distancing. This is something that we must have. And therefore, I am convinced, personally, Jiroge, that Kenyans will continue to do what they have done in the past and largely have followed the protocols that have been developed by the Ministry of Health. And for that, I want to thank them.
All right. Thank you so much, Waziri, for making time. We do appreciate highly.
Thank you very, very much.
Asante sana.
Asante.
All right.